Hi, welcome to Stanislaus County Behavioral Health and Haven Programs, serving welfare to work customers. My name's Sarah, and I'm here to provide you information and guide you through program options. First, I would like to share my story so you know you're not alone in the process. Then I will tell you about the programs you may choose. Finally, I'll provide answers to frequently asked questions that can help you in your decision. You and your welfare to work case manager will work together throughout your journey to your well-being and self-sufficiency. A few years ago, I was in a really bad place. I lost my job and wound up in addiction. I ended up in the psychiatric hospital where I contacted CPS for help. I was blessed with a couple of amazing workers at the Community Services Agency who became my main support system. They encouraged me and helped me put together an action plan to recovery. They enrolled me in domestic violence classes, parenting classes, along with co-parenting classes. They helped me get involved with counseling and put me through inpatient and outpatient treatment. After treatment, they helped me get into an apartment. The Community Services Agency helped me gain employment through the Welfare to Work program, along with child care assistance and gas mileage reimbursement. I remained a temporary employee at that employer for 5 years until I gained full-time employment at the Community Services Agency. Most of our services are confidential and private. I'm going to take a few minutes to show you what some of our services look like. This is an example of our Domestic Violence Havens program. Havens Women's Center and Behavioral Health Services are on-site clinics, contracted by Community Services Agency, to provide short-term services exclusively for families receiving cash aid. Havens Women's Center provides 12 weeks of individual and small group services for female and male victims, past or present, for domestic violence, sexual assault, and human trafficking. Crisis counseling, legal services, parenting classes, and temporary shelter options are also available. The main office provides supportive services for the minor children, including youth support groups. Individuals court-ordered for domestic violence and parenting classes are referred out to court-approved community programs. These services offer 12 weeks of mental health or substance use counseling. Hello again. We're now at Stanislaus County Behavioral Health Services, also known as BHS, co-located at the Community Services Agency. We will now take you on a guided tour of what mental health services and substance abuse services look like. You can decide if these services might meet your needs. Let's take a brief look at a session with mental health services. Now let's take a brief look at a session with substance abuse services. These services offer 12 weeks of mental health or substance use counseling. If you accept mental health or substance use services from a community agency other than BHS, we may track your participation hours in Welfare to Work. All services are offered to adults in the case. Minor children are referred to appropriate resources in the community. Mental health services consist of 12 weeks. This includes individual strengths-based therapy with licensed therapists, small group seeking safety coping skills, and intensive case management services. The 12-week Seeking Safety group is facilitated by an experienced mental health behavioral specialist. It's an invitation to try new, safe coping skills and to grow a network of supportive connections. This new skill set is practiced in therapeutic outings, which may include a horse ranch or animal farm. Substance use services is 12 weeks in length and consists of small groups of about 5 to 8 participants. They provide the opportunity to identify substance use issues or self-medicating. The goals are to ensure you can pass a pre-employment drug screen test, reach a sense of well-being, and access to recovery support services in the community. Welcome. We're at Rosie's Journey of Hope in Oakdale, where behavioral health services bring their clients for therapeutic outings.
What are the hours of service?
Our hours of service are Monday through Friday, 8 a.m. to 5 p.m. Behavioral Health's 24-hour, 7 days a week support line is 209-558-4600, and Haven's is 209-577-5980.
If I choose Haven Domestic Violence Services and I am currently in a relationship, will that affect the services provided?
No, not at all. This is a voluntary program. Haven offers you confidential information, education, assistance, and options to consider.
How much will the family service specialist know about me? Will Haven or BHS share my personal information?
No information is released without customer approval and assigned release of information. BHS and Haven are only required to report welfare to work weekly hours of participation attendance to the Community Services Agency, imminent or current danger to self, others, or grave psychiatric disability, child protective services, and adult protective services for concerns of child abuse, neglect, or elder dependent adult abuse or neglect. We attempt to include the families in the process of reporting.
Will you take my kids away?
No, BHS and Haven do not make those assessments or decisions.
We are homeless. How can we get by and attend your services?
Your Welfare to Work case manager can help you with housing resources and may customize your Welfare to Work activity schedule.
Is there transportation available? It takes too long on the bus.
Yes, Monday through Friday, BHS provides transportation door to door, prioritized for those in outlying regions of the county. We only request that you contact us the day before if you're not going to attend services.
Do you provide childcare?
Unfortunately, BHS does not provide childcare on site. The childcare program is available for Welfare to Work customers who are eligible. You must apply and choose your own provider. You can work with your case manager for more information.
Can I cancel services or change counselors? Will I get in trouble?
It is common for it to take a while to know if a provider or service is a good fit for you. As a Medi-Cal beneficiary, you have the option to complete a change of provider request form, or discontinue services, or you can discuss your options with your family services specialist.
Will I have to find another work activity if I opt out of services after the mental health, substance use, and/or Haven intake assessment?
With your family services specialist, you will need to identify an alternative approved activity.
Will your programs help me obtain Social Security disability benefits?
In many instances, we provide supportive services. We do not, however, write letters to Social Security. We encourage customers to contact the local Stanislaus County Social Security office with any specific questions. If you are considered disabled by Social Security, you may be exempt for Welfare to Work activities. If you are exempt, you may voluntarily participate in any Welfare to Work activity, including mental health, substance abuse, and/or domestic violence services.
If I find services closer to my home, can I obtain Welfare to Work participation credit?
In many instances, yes. You would first need to consult with your case manager. They will contact us to confirm if the particular program is suitable.
Are you going to conduct unannounced home visits or inspections?
No, BHS and Haven do not conduct unannounced home visits or inspections.
Can court-ordered services count as approved Welfare to Work activity, such as DUI, counseling, anger management, domestic violence, parole, or probation?
Yes and no. Yes, we provide tracking for court-ordered services such as counseling, anger management, Prop 36, drug court, and DUI classes. No, we are not permitted to track participation for court-ordered domestic violence perpetrator classes, provided by Sierra Vista and Stanislaus County Day Reporting Center.
Do you provide couples counseling or family therapy?
No, but your case manager can provide you with more information about where to find these services.
What if I want additional therapy services beyond the 12 weeks?
First, our team will meet with your family services specialist. We explore referring you to behavioral health adult team or your health plan for a list of private providers. Evenings or weekend hours, we refer clients to their health plans or community-based programs.
Do you offer services in different languages?
Yes, we can assist you in whatever language you prefer. We also provide services to new refugees in collaboration with World Relief and the International Rescue Committee.
Do these services cost money?
No, all behavioral health services and Haven services are free. Thank you for joining me on this guided tour of behavioral health and Haven services co-located at Community Services Agency. If you have any further questions or are interested in these welfare to work activity options, please contact your family services specialist, also known as your CSA case manager. Best wishes to you and your family.